valuable learning and insights from this FDP. Today, as we wrap up, we will have first session by our expert, which will be followed by the vote of thanks. So without taking much time, let us begin. It is my honor to invite our esteemed speaker for today, Professor Dr. Deepika Chamoli Shahi, who is a psychologist, clinical hypnotherapist, adjunct faculty at SNHU and St. Leo University, U.S.A., and also the founder and director of SpeakingCube. Ma'am will be conducting a session on correlation and experimental research. So we are delighted to have you, ma'am, with us today, and this virtual stage is yours. Over to you, ma'am.
Thank you, Sneha, for handing over the forum. I hope I'm audible.
Yes, ma'am.
Just give me a second. Okay. So a very refreshing good evening, everyone. I hope I'm loud and clear. We were expecting another session.
You are audible to us.
Thank you, Hitesh. We were expecting a session from Dr. Anita, but because of her health issues, she could not take the session. So let me conduct a detailed session about correlational and experimental research design. And we have so many research scholars. So I think professors are already aware of few of the research designs. Maybe it will be an add-on, but it is going to be focused solely, and that is why we kept the session at the end, solely focused on PhD research scholars, as well as those scholars who are assistant professors also and teaching in the university, right? So let me share my screen. I'm going to share my full screen, so I will not be able to see you. In between, if you have any question, either you can just unmute and speak, or else we will take up the questions at the end. Okay. So let me share my screen first. Sneha, let me know whether the screen is visible or not.
Yes, ma'am, it is.
It is. Okay. Right, it's visible, clear?
Yes.
Okay. So, not experimental, but we are going to talk about both correlation and experimental research design. So let's start from research design itself, right? Okay. Let's make the session interactive at the starting initially, right? Because the information which is going to come now it will be an add-on to the existing knowledge, or maybe it is something which is new. So do you think, now my first question to those who are actually research scholars, right? Do you think that research design, talking about or discussing about research design matters?
Yes, ma'am.
If so, how and why? Just in one line or two lines, why?
Ma'am, it gives brief idea how we are going to process our research, in what way and in what area.
Excellent, Saloni, right? If we do not have a proper pen picture in our synopsis, if we do not have a pen picture or a blueprint of what we are going to do in our research will go in vain. Okay. So somebody who is Dr. Bruta, he is known in the field of, he's a psychologist, and he has written a lot of books on research methodology. And he was a great academician. Now sir is not there, but once upon a time when I was doing my PhD, he told me, Deepika, a lot of researchers conduct good researches, but the problem is the research design has fault. and therefore the complete work go in vain. So a lot of PhDs are rejected because of this. A lot of papers are not published in good journal because of the nature of research design. So let's talk about that. Why this? What is actually there in the research design, and what we need to know, how we need, and how we have to go ahead as far as our research is concerned, right? So when we talk about the research design, somebody has written correctly, it's a blueprint, it's a framework that guides the collection, measurement, and analysis of data in a study, right? So when we create a research design, we have a picture that, okay, we are going to go ahead with survey research design, or we are going to go ahead with qualitative, quantitative, descriptive, exploratory, experimental, right? Now, what are these? These are the terms which are probably some terms are new to you, right? It provides a structured approach, an algorithmic approach, because we are following a scientific pattern. So it is an structured approach. It is an algorithmic approach to answering a research question, ensuring that the study's goals are met in an organized, reliable, and valid manner. These three: organized, reliable, valid. Most of the times, even if one is not met, the study is not considered to be a good study. So it's an overview. It's an overview slide of what we are going to talk about. So when we talk about the research designs, they are broadly categorized into qualitative research designs and quantitative research designs, right? Today, we are going to focus purely on quantitative research designs. So in qualitative research design, we have historical, we have phenomenological research, ethnographic, case study, and grounded theory approach, right? So in future, definitely I'll be conducting, because somebody has suggested me that qualitative research design, a workshop on qualitative research design is necessary. So in future, we are planning to conduct the same. When we talk about today's topic, which is quantitative research design, it is experimental and non-experimental, right? Now, experimental research designs are of three types, based on certain criteria, based on certain assumptions, based on certain guidelines, certain norms. True experimental research design, quasi-experimental research design, and pre-experimental research design. Then we have non-experimental, which is descriptive, developmental, surveys, cause comparative, predictive, and relationship. Now we will talk about them one by one. Now, if you just club them together, then these are the types of quantitative research designs that we have. And non-experimental and experimental. Experimental will be experimental and quasi-experimental. Non-experimental will be correlation and descriptive. Descriptive will further have case study approach, observation approach, right survey, etc., etc. One by one, we are going to take it up. So when we talk about non-experimental research designs here, right? Non-experimental research designs are descriptive type. What do you mean by description, right? Suppose we are conducting a survey on mental health, the prevalence of depression in Uttarakhand, or the prevalence of depression in UP or some area, right? Or I'm doing an observation approach, or I'm doing through a study through case study approach to describe the characteristic of a population and situation without examining the relationship. I'm not interested in finding out the relationship, but I'm more interested in finding out the prevalence, right? So that is called descriptive research design. Now it can be done using a survey approach, an observation approach, and even case study approach using quantitative analysis, right? Now, survey. When we talk about survey, which is again a part of, or we can say in few of the books, you will see them as a division of descriptive only. I have highlighted here survey, observation, and case study. And in certain books, these are different, right? But what does a survey does? What a survey does? Collects reported data to describe opinions and behaviors. So there are a lot of surveys that we come across in our day-to-day life. Even on Facebook, a lot of surveys we take up. On certain research groups, a lot of surveys we take up, right? Certain questionnaire. They are self-reported. Self-reported means the individual himself, the participants himself is reporting. It doesn't need any expert for the data collection, right? Right now in many of the researches, we are creating Google Forms which are self-reported, opinion based, right? So this is basically called survey. And here the examples are questionnaire on tech use. This is one of the example. Then comes observational research. Observational is you are directly observing and recording the behavior. In behavioral science, we do in neuropsychology also, in neuropsychology we do the observational research. We record the behaviors, and that too in the natural setting, not in the lab setting, right? So basically, classroom observation, you are observing the attitude or perception of the students in a classroom setting. So that is an observational research. And then comes developmental research. Developmental research, which is also known as cross-sectional or longitudinal study. So it examines a change over a period of time. Maybe suppose you are interested in understanding the cognitive development of a child from 5 to 10 years. So what are you going to do? Whatever test you will be utilizing, right? Whatever test you will be utilizing will be age. Suppose for cognition, you have utilized memory test, or for cognition, you have utilized attention or perception, any test, or for say IQ test, right? So you have examined it at 4 years, 5 years, 6 years, 7 years, 8 years, 9 years, 10 years, right? So what kind of research it is going to be? Obviously longitudinal research, and you are basically focusing it on the developmental aspect. Then comes the epidemiological research, where it studies the distribution and determinants of health and disease in the population, right? Example here is cohort study of smoking effect is one of the example. We can do a cohort study on use of alcohol, right? And then comes a case study. Case study is something which is included both in quantitative research design as well as your qualitative research design, right? So when we do the quantitative study in quantitative case study, it is an in-depth analysis of a single case, group, or events. So we do this kind of study in medical cases. So they are not qualitative in nature. We are purely basing them on the nature of numbers, and that is quantitative. And it gives a detailed medical study, neuropsychological studies, right? Study using EEG and so forth. Now, when we talk about non-experimental research design, these are the types of research design, and the last research design that it has is correlational research design. Now, when we talk about research design, it is in itself a very huge topic. 1 hour, 1.5 hours, 2 hours are not enough. So whatever I will try my best to talk about at least 2 types of research designs in the best manner, because they have multiple subdivisions, right? So the last type of non-experimental research design here is correlational research design. Now, correlational, if you break the word correlation, what do you get? If you break the word correlation, what do you get? Correlation, what does it mean? Anybody? The literal meaning of correlation? Literal meaning of correlation? Anybody? Relation, right? When I'm talking about relation,
more events.
yes, correlation. You are trying to find out the degree of relationship or relationship between, or the link between 2 variables, right? 2 or more variables. So this is correlation. Now, suppose if I have to give you an example, relationship between mindfulness and work-life balance amongst Gen Zs. Okay, or amongst young adults. This is a topic. So how I am going to take it ahead? What kind of research design it is? It will be a simple correlational research design, because the topic itself says relationship between or correlation between this and this. But do we have multiple types of correlationship designs? Yes, we do have. We do have different types of correlational research design. When we are talking about correlation, this is the first thing that you have to understand here is it is a non-experimental research design where you are not doing any experiment. Since you are not doing any experiment, therefore, you will utilize other methods to find out. I will talk about the methods also. Other methods to find out the relationship between variables. Now, what are the variables? You know that variables are the measures we are interested in, maybe an independent and dependent variable. But when we talk about correlational research design, do we have the true independent and true dependent nature of variable? Anybody? Yes or no? Anyone? Whatever it is. If you know, say yes. If you don't know, say no. Right? Yes. Okay. Anyone else? Anyone else?
What was the question, ma'am? Can you please repeat it?
The question is, if we have variables in any research, suppose it is a correlational research, do we have, in correlational research, do we have true independent and true dependent variable?
Yes, not true dependent or independent variables.
Right, correct. Now, see, whenever you are doing a research, you are interested in some measure, right? That measure is sometimes it is apparently the cause and apparently the effect. Okay. In few of the researches, the variables are just there. You do not know which is the cause and which is the variable. So in true correlational research design, we do not have true independent nature and true dependent nature of variable. Understood this much? We have just the variable, and therefore we are only interested in finding out the relationship between the two variables. We do not know what is the cause. We do not know which is the independent variable or dependent variable. But when we move ahead towards a step ahead, wherein we would like to understand the impact of one variable on another variable, there we have independent, although it is a correlational research design. But what do we use here? It is the regression type of correlational research design, where we regress, we find the predicting nature, right? Predictability or impact. So that's why there are 3 words that we use in the title of correlational research design. Always remember, this is the first mistake that we researchers do. We use the word relationship, correlation. We use the word impact or predictability. If we are using the word impact and predictability, understood, it is going to be a regression study, where you will be finding the impact of one variable over the other variable. In this study, we will have to label one variable as predictor and one variable as dependent. Okay? But when we talk about correlation and relationship, we just have variables. We do not have true independent and dependent variables. Okay, let me share the screen and let's make it more clear. Right? So now here, correlational, I've discussed about the correlational research design, and it examines the relationship and association between variables without manipulation. That means we do not label one variable as the cause. So we do not manipulate, because if it is independent variable, we have to manipulate it. Okay. So study of sleep and exam grades. If you want to find out what is the relationship between the hours of sleep and the grades. Okay, now when we talk about the quantitative research process, how is it? First, let's just go through this slide. We create a problem, right? We are interested in. So the first thing that we do is we search the area of interest. Suppose my area of interest is mindfulness. Now, in the broad mindfulness, I will try to formulate my tentative problem and what is the purpose of my study. Because there has to be a purpose of study, there has to be the aim of the research, right? For what we are doing. Obviously, we are doing it for the benefit of mankind, for the benefit of society. If we are doing just for the sake of doing, a lot of researchers in psychology and other fields have been done like that, and they have taken 10 years, and after 10 years, it was of no use. So it was sheer wastage of resources and manpower as well as time. That you should not do. So fix your aim, fix your purpose, and then formulate a tentative research problem. On the basis of your research problem, you will define your direction, and that direction will be given by your objectives. Suppose my title is to find a relationship between mindfulness and work-life balance amongst young adults. So what is going to be my objective? To find out the relationship between mindfulness and work-life balance amongst young adults. That is going to be my objective. I'm giving a direction to my research. And then you will define a hypothesis. Hypothesis, what is a hypothesis? It's a pre-assumption. Obviously, I'm not going to go into the details because a lot of speakers, a lot of experts have already discussed about it. Hypothesis is a pre-assumption. You have at this stage not conducted the study. You have not conducted the study, but you are thinking, okay, my answer, my result is going to go in this direction. This will be my tentative pre-assumption, right? Pre-assumption means it will be in future. It is, you have not started doing the research, but you are pre-assuming that this is going to be your result. That is why it is called pre-assumption, and it should always be in future tense. A lot of students and even the faculty members commit this mistake. They always write it in the present tense. Do not never write it in the present tense, future tense. There will be a significant, in this particular case, there will be a significant relationship between mindfulness and work-life balance amongst a young adult. This is going to be a hypothesis, right? You can take it null hypothesis in alternate hypothesis form, simple or directional or non-directional hypothesis form, whichever direction you want to form, whichever type of hypothesis you want to create. Then you will obviously do the review of literature. Before the problem also, we do the review of literature to understand the research gap, and then create a tentative research problem. Now you come down to the literature review. Literature review, you'll do the literature review, you'll refine your purpose, you'll refine your problem, hypothesis, and then you will create a conceptual framework on your research is going to be based. You will consider the theoretical theories, principles, concepts, which were published by the researchers earlier, and which is already there in the research pool, right? You'll create a conceptual framework for your study, and then you will come down, you'll think about your research design, how I have to do this study. Now, since I have already created a title, relationship, so obviously my study design, my research design is going to be a correlational research design. Suppose a title is the effect of mindfulness on work-life balance. If the relationship word is replaced by the word effect, it is going to be an experimental study. Am I clear? So the title shows what kind of research design you are using in your study. It is that systematic. A is connected with B, B to C, C to D, E, like that, right? So when we go ahead with the experimental research design, we use the word influence, we use the word effect, right? We use the word compare, because this is what we do in experimentation, right? Then we do the sampling, whether it is random sampling or it is stratified random or whatever kind of convenient, judgmental. There are multiple types of purposive, non-purposive, multiple types of sampling style. Whatever sampling style suits your title and best for the research design, you will choose that. You will choose your instrument. Whatever, if it is a field in the field of psychology, we use a psychological instrument, or we create certain instrument for testing, right? If there is any legal or ethical implication, you will establish that. We collect the data analysis is done. Once you do the data analysis, you create your result is out. After your result is out, now you discuss your result in light of the priori. Priori means the previously established researchers, right? And that is what we do in the discussion part. Okay, and then there is summary and references, and if there is any budgeting and funding thing, then you can mention. I hope, is it clear? Please unmute and say if it is clear or not.
Yes, ma'am.
Okay, moving ahead. This is an example. Here you can see I have already given an example of mindfulness. Let's see relationship between stress level and academic performance. So it is a correlational research design because this relationship word is used here. Aim is to examine the relationship between perceived stress and GPA. Hypothesis, there is a negative correlation between there. What is something which is wrong? There will be future tense, right? Am I clear?
Yes, ma'am.
Yes or no? Yes. So here, correlational research design. Suppose I have taken here a random sampling. This is the data taken from existing research, right? This research has already been done. So independent variable is perceived score. Dependent variable is academic performance. Data collection tool is standardized questionnaire for stress, and you have done the Pearson correlation coefficient, right? Statistical analysis, which you have probably understood in R as well as in your qualitative and quantitative research session and your SPSS session. Right now, moving ahead with the details of correlational research design. So now basic of research you have understood, basic divisions of or basic types of research designs you have understood. From the non-experimental type of research design, we are talking about the correlational type of research design. So it is one type of non-experimental research design. Okay, so correlational research design is a type of non-experimental research design that investigates the relationship between two or more variables. Unlike experimental research, it doesn't involve manipulation of the variable. As I have already discussed, we don't manipulate the causal variable because there is no true independent variable, but rather observes and measure them as they naturally occur. We are not utilizing any intervention. We are not giving any treatment as far as correlation is concerned because we are only measuring the relationship. The primary aim is to determine whether a statistical relationship exists between the variable, or if so, what is the strength and what is the direction of relationship. Right. So now when to use correlational research? You can do the correlational research if you are doing an exploratory study. Right. So when exploring new areas of your research to identify potential relationship between variables, for example, suppose a relationship between mindfulness and exercise, physical exercise has not been established. This is the gap. So I want to study that whether there is a relationship between mindfulness and exercise or gymming, right? So I'm just interested in whether there is a relationship, something, a negative relationship, positive relationship, neutral relationship, that is altogether different. So that is called exploratory research, where you are exploring. Now we have ethical constraints. There are, in certain researches, we do have ethical constraints. For example, if you are using human participants and it is an invasive procedure, experimental research design is going to be an invasive procedure. So how to do? How to go ahead with that research? Make it a correlational research because there you will not be experimenting on them. So ethical consideration is not a concern. So when manipulation of variable is impractical, manipulation of variable we do in experimental designs, right? Then where in those situations where we cannot go for manipulating the variable ethically, and ethical constraints is a big time problem, there we can go for this. Then prediction studies, as I have already mentioned, whenever we want to predict an outcome. So when predicting outcomes based on the relationship, such as predicting academic success from study habits. This is a title, predicting academic success from study habits of school-going children from 8 to 13 years. Suppose this is the topic. Now you want that how it is impacting, how academic success is being impacted by the study habits, right? Whether it is predicting study habits or not. then we go for a correlational research design, but the statistics that we will use will be regression. Okay, when we go for relationship and correlation, and this predictor word is not used, impact word is not used, we go for correlational statistics, Pearson correlation, right? Analyzing trends, understanding how variables interact over time, like temperature and electricity consumption. This is also where we can use further correlational research. Now, when we talk about the different types of correlational research, obviously we have positive correlation, negative correlation, and no correlation, right? When we talk about positive correlation, what is that? Wherein one variable increases, the other also increases. That means there is a direct proportion, we can say that, right? So the relationship between exercise frequency and physical fitness, you know that if exercise frequency increases, physical fitness will also increases, right? Physical fitness will increase, sorry, right? Negative correlation is the one where if one variable increases, the other decreases. For example, if stress level increases, job satisfaction, academic performance, these are the things that decrease. So there are certain things which have already been proved by researchers. So I am taking it as priori. Now, no correlation means no consistent relationship exists between the variables. You are interested in focusing on whether these two variables, you are saying that these two variables are not connected, related. The relationship between shoe size and intelligence. So a lot of people do say no. In the tribal population and also in the remote Himalayan culture, it is a saying that if you have the number of your shoes is big, the intelligence is low, right? And if suppose you are doing a study on the same, so what is your basically thought process? To go for no correlation study, right? Then linear correlation, wherein the relationship between variable follows a straight line pattern, right? And example here is the relationship between our study and exam performance. If our study will increase, exam performance will also increase. Then there is non-linear correlation. Non-linear or curvilinear relationship is something wherein it is not going to go in a straight line, whether it is positive direction or negative direction. It takes a curve. Some relationship is there, but it is a curvy relationship, right? So relationship between variable follows a curved path, a non-linear path, and therefore it is called curvilinear or non-linear correlation. The relationship between arousal and performance as per Yates-Dodson law, right? So you can read it. Any relationship, any variable you can take, wherein you think that it is not going to be a linear relation, whether it is in positive direction or negative direction, it is going to be, there will be a relation, and it is going to be a curvy linear relation. Okay. So see, this is positive. So when this is a scatter plot basically, right? So here you can see the positive linear correlation scatter plot. This is how it looks like. So we imagine a line from here to Y. This is that too in the positive line. And if it is from X to Y in the opposite direction, it is a negative linear relation. Now, what are these dots? These dots are called data sets. These are the scores, and the scores are lying here around the line itself. And therefore, this is linear relationship. Now, here in curvilinear relationship, you can see that the data sets obviously are close to each other, right? But it is not linear. It's a curve. So it is called a curvy. So relationship is there, but it's a curvilinear relationship. It is a negative curvilinear relationship, positive and negative. And this is independent, wherein the samples are just scattered or no correlation. Now, when we talk about the statistical assessment of relationship, that how we go about the statistical assessment, which test to choose. So if the data is, it depends on whether your data is quantitative in nature or nominal. Nominal means categorical in nature, right? For example, age, gender, etc., etc. So if you have two or more than two predictor variables, okay, so that also is a question. Here, if the variables are quantitative in nature, the data is quantitative in nature, right? And if you have two predictor and one dependent, then we will go for regression, as I have discussed in the previous slides. Prediction or impact study we do from regression analysis, right? And then if you have only one predictor variable and one other variable, not predictor variable, but yes, if you have two variables and you want to find the relationship, then you will go for correlational analysis, right? If it is a nominal variable, categorical variable in nature, right? So you have to think about, do you have more than two predictor variables? If it is so, you will go for chi-square test. So this much. And now what is the range? What is the range of correlation when we talk about? The range of correlation is -1 to +1. So correlation always lies between -1 to +1. So if it is minus, towards minus, negative correlation. If it is towards plus, positive correlation. If it is in between, you have neutral correlation. Now, moving ahead, what are the limitations? Every research design has some limitations. Now, you know, as we have discussed, in correlational research design, we can find a relationship, we can find impact, but we are not able to manipulate the independent variable. Okay, so here that means you in correlational research design, there is an inability to establish causality. Now, when we are saying causality means causal relationship, cause and effect. So there are, in general, in any research, either we are interested in finding out relationship, or we are interested in finding out what is the cause and what is the effect, which is called the causal relationship. And we do that. We try to find out the cause and effect relationship in experimental research design, in quantitative research designs, right? Another limitation of correlational research is potential of confounding variables. Now, there are we are in correlational research design, there are two variables and we are establishing a relationship. Suppose you are establishing a relationship between sleep hours and academic performance. But what about the demography? What about the climate? What about the qualification of the parents? What about the quality time that parents are basically spending with the kid? So have you taken them into consideration? So if you have to take them into consideration, you cannot go for correlational research design. So obviously here this impacts the validity of the research a bit. Okay, so in a study examining the correlation between physical activity and mental health, a confounding variable can be or could be socioeconomic status. Now I've given you another example also. So without controlling for these confounding variables, we are basically establishing a relationship. So sometimes the research might incorrectly attribute the relationship to the variable that we are studying, right? So it can adulterate our research. Okay, everybody, up till here?
Yes,
Yes,
ma'am.
Yes, ma'am.
Okay. Okay, moving ahead. Moving ahead with the experimental research design. Experimental research design. Okay, let me have a word with you and then I will speak. Okay. When we talk about the experimental research design, what do you understand? With literal meaning of word experiment. Experiment. Is it? Experiment to experiment.
Trying something new is experiment with different variables. Like if in life sciences, I'm carrying a study in forest, and I'm seeing the climate effect on it, and I'll be generating a result according to
So,
my experiment. So it's
okay, you are doing a study in botany.
yeah.
ओके बॉटनी में आप कर रहे हो एक्सपेरिमेंटल कर रहे हो आप
Yes.
उनको कुछ कंडीशंस दे रहे होगे
Yes, there are conditions.
yes so what do we control, we manipulate, we have a test group, we have an experimental group, This is what we have in the experimental research design. So experiment means we are actually experimenting in the experimental research design. But how many types of experimental research designs have you heard about? What are we basically generally doing in one line? We are trying to establish a cause and effect relationship. क्या कर रहे हैं हम experimental research design में? We are establishing cause and effect relationship. Simple. What is the cause? Independent variable is always the cause. And dependent variable is always the effect as far as experimental research design is concerned. Now, if I ask you, experimental research design में क्या ऐसा होगा कि true nature of independent variable and dependent variable है? What is going to be your answer? Go ahead, please. Go ahead. True independent and true dependent nature of variable होगा.
यस, जो
Go
हमारी
ahead.
कंट्रोल्ड कंडीशन है उसमें डिपेंडेंट वेरिएबल जो होगा वो होगा व्हाट यू सेड, वर्ड आई एम नॉट गेटिंग.
एक्सपेरिमेंटल स्टडी में कंट्रोल आपका कॉज भी होगा और इफेक्ट भी होगा. कॉज
Yes.
इज इंडिपेंडेंट, इफेक्ट
Yeah.
इज डिपेंडेंट
Dependent.
वेरिएबल.
Yeah.
आप मैनिपुलेट क्या करोगे किसी भी एक्सपेरिमेंटल स्टडी में? वी ऑलवेज मैनिपुलेट द इंडिपेंडेंट वेरिएबल, क्योंकि डिपेंडेंट तो इज डिपेंडेंट ऑन इंडिपेंडेंट वेरिएबल,
It's
right? So what kind of relationship we are trying to find out here? We are trying to find out the cause and effect relationship here in the experimental research design. There are numerous types of experimental research design that I am going to talk about. थोड़ा सा कंफ्यूज हो जाओगे, बट धीरे अगर ध्यान से देखोगे तो उसमें देखना छोटे छोटे डिफरेंसेस हैं, और वही हमारे रिसर्च डिजाइन को बेस्ट रिसर्च डिजाइन बनाता है. ओके, लेट मी शो यू. राइट, सो ब्रॉडली इन एक्सपेरिमेंटल रिसर्च डिजाइन वी हैव true independent and dependent nature, independent variable, right? An experimental research design method is a research that is guided by specific hypothesis. हमेशा इसमें ऑब्जेक्टिव होगा, हमेशा इसमें हाइपोथेसिस होगा, and it is very useful for guiding decision making, etc., etc. So let me just read whatever is written in the slide and then we will discuss. Experimental research design is a type of research design which is commonly used in scientific, it is called scientific research design. And in scientific researches, we use it. It is the primary approach used to scrutinize the cause-effect relationship underline. यही हमने बात की है अभी. हम क्या करते हैं इसमें? Cause and effect relationship find out करते हैं. We investigate the effect of independent variable on the dependent variable, because independent variable is the cause जिसको हम मैनिपुलेट कर रहे हैं किसी भी कंडीशन पर. This kind of research is also known as hypothesis testing and deductive research method. It is used to support or disprove hypothesis. Always remember, I have seen many of the researchers, they become very sad when their hypothesis is not accepted. After doing the research, after collecting the data and doing the data analysis, the research shows that hypothesis is not accepted. Sorry. Right? And they feel so sad, they get demoralized. But the experimental research design proves, either it supports and either it disproves the hypothesis. This is what the experimental research design is. तो हमारा जो hypothesis होगा, हमें जरूरी नहीं है कि हमें उसको prove करना है. That is why sometimes we create a non-directional kind of hypothesis, right? Moving ahead. When we talk about the types of experimental research design, it can be pre-experimental research design, true experimental, quasi-experimental. ये तीन तरह के experimental research designs here. Now all these three types of research designs are further divided into their subtypes. Let's talk about them. What is pre-experimental? Now when I'm saying pre-experimental, तो pre-experimental का मतलब क्या है? A researcher observes a group or multiple groups after implementing a treatment or introducing a factor that is assumed to lead to changes in the group. And this is used to understand if further research is necessary for observed group. बहुत बार हम pilot study भी करते हैं. Pilot study में sometimes we go for a pre-experimental. I am interested in doing a study on large population, but I'm not sure what kind of direction is going to be. So I take up a small sample of 20, 30 or 50 whatever and do a pre-experimental design on them. अब अगर मैंने उनके ऊपर pre-experimental design कर दिया and I have proved something, right? Obviously, to and fro as far as my hypothesis is concerned, then I will have an idea. I have explored in that experimental research design. I have explored that experimental research design. Okay, I can do it. So pre-experimental research design इन्हीं चीजों के लिए use किया जाता है, right? Then there is true experimental research design. True experimental research design depends on a statistical analysis to support or refute the hypothesis. Simple. And it has a true nature of experimental design. True nature of experimental design क्यों बोल रहे हैं? Because we are following random sampling. We are picking up the samples randomly. We have recruited the samples, subjects randomly, right? And quasi-experimental research design. Quasi-experimental is participants are not chosen at random. Experimental तो है, but participants को हमने randomly नहीं choose किया. Now let's talk about, you know what is independent variable? It is the variable which is manipulated. It is also known as cause, as I have discussed. Variable is the effect or the outcome of the independent variable. Experimental group is the group which will receive the treatment. Okay, and control group is the group which will remain fixed. So medical, अगर हम researches करते हैं तो medical researches में we keep one as control group, one as experimental group. Suppose कोरोना की medicine आई, एक को हम वैसे ही treat कर रहे थे, दूसरे को हमने existing medicine के साथ कोरोना की medicine भी दी, right? And then we have found out the effect. So what kind of research design it was? It was a true experimental research design. When we talk about the purpose of experimental research design, it is to understand the causal relationship. It is always cause, control, and variability, right? Causation allows the experimenter to make causal inference about the relationship. Control allows the experimenter to rule out alternative explanations due to confounding effect and extraneous variables. I have just discussed about the confounding variables, that a lot of other variables are also present apart from independent and dependent variables, right? Those which can be controlled in the lab settings. तो हम control करके भी उनको निकाल सकते हैं. And there are other research designs also. There are various type of experimental research designs wherein this happens. Then comes variability. It reduces variability within treatment conditions, which make it easier to detect differences in the treatment outcome. When I am saying treatment, I am not talking about the medical treatment. I am talking about intervention. I am talking about condition. Okay. So what are the steps for experimental research design? We identify the problem, formulate hypothesis, design the procedure, and carry out the experimental procedure, then analyze the data. This is simple. Now, when we talk about experimental research design, experimental research design, pre-experimental, true experimental, quasi-experimental, statistical, हम last में बात करेंगे because it is new. Pre-experimental research design is one-shot case study, one group pre-test, post-test, and static group. True experimental is pre-test, post-test, control group, post-only research design, and Solomon 4 group. Quasi-experimental is time series and multiple time series. And then we have statistical, randomized block, Latin square, and factorial designs. Let's talk about them. Okay? याद रखो इन तीन के भी subdivisions है. And I am taking pre-experimental research design first. It has 3. So pre-experimental research design involves one or more experimental group that are observed under certain treatment. हम किसी कंडीशन हमने दी और हम उसको ऑब्जर्व कर रहे हैं उन ग्रुप को. इट कैन बी वन और मोर ग्रुप. इट्स अ सिंपलेस्ट टाइप ऑफ रिसर्च डिजाइन एंड फॉलोज द बेसिक स्टेप्स ऑफ एन एक्सपेरिमेंट. But the only problem is there is no control or comparison group here in the pre-experimental research design. This means researcher can say that participants who received a treatment showed some change, but they cannot be sure that the treatment caused the change. Yes? Understood everybody?
Yes, ma'am.
We do not have control group, compare group here. We have 2 or more groups. We can have 1 or more group, experimental group, wherein we are experimenting. But experiment करके हम उसको किसी previous group से compare नहीं कर रहे, control condition से compare नहीं कर रहे. right? And therefore, pre-experimental research design can still be useful for exploratory research, as I have discussed earlier. If I am interested in carrying out a big study, I will go for pre-experimental research on a small data first, right? So it allows the researchers to test the practicality of any research design or viability of the experiment, right? So this can be the first step in most of the experimental research designs. This helps in refining methodology. अगर कुछ इसमें कमी पेशी आ जाती है और हमको लगता है ना confounding variables दिक्कत कर रहे हैं, so we can control those confounding variables in our true experimental research design later on, right? It provides a preliminary data on how a treatment or intervention might affect the study variable. And also, it informs the researchers about potential impact and feasibility of scaling up to larger, more controlled experiment, as I've just discussed. अगर मुझे एक बड़ा experiment करना है, तो I'll do a small experiment with pre-experimental research design because वो cost effective भी होगा and I'll be able to understand the changes if I have to make later on, right? So it saves my time, it saves my money, it saves my resources and my efforts. Findings from pre-experimental research design can guide and design a stronger experiment, right? So this is why we use this design. Now, there are three types of pre-experimental research design that we can go for. One is post-test only, which is also known as one-shot case study design, right? It is a single group design, right? And observed at one point in time after receiving some treatment. So you have given a treatment and you have observed the group after giving the treatment. Treatment can be anything. And researchers compare the outcome to what they expect would have happened without the treatment to other casually observed events. So here an example is given. An organization implements a new customer service protocol. पहले कोई सर्विस प्रोटोकॉल नहीं था, ऐसे ही चल रही थी सारे ब्रांचेस में. नाउ दे हैव स्टार्टेड अ न्यू कस्टमर प्रोटोकॉल इन ऑल द ब्रांचेस एंड अ वीक लेटर कस्टमर सेटिस्फैक्शन स्कोर्स उन्होंने निकाल लिया. And now they understood, okay, customers are getting, हम positive direction में customer satisfaction सोच रहे थे, and this is actually leading to some positive satisfaction, right? So this is post-test only, as the name suggests. Post-test only means एक ही बार treatment के बाद pre-test नहीं होगा, treatment के directly बाद आपका post-test होगा. So before you are not concerned about, you have a group and you give intervention and just test the group only once, which is post. Okay, now there is one group pre-test, post-test. Pre-test, post-test means they'll be testing 2 times. A single group will be tested 2 times before and after the treatment. After the treatment means intervention, administered, conditions applied, whatever, right? But there is no control and comparison group. हमारे पास कोई control or comparison group नहीं होगा. For example, a school has basically started a counseling program. ओके, प्री टेस्ट हुआ बच्चों का मेंटल वेलबींग का, उसके बाद काउंसलिंग प्रोग्राम हमने कुछ महीनों चलाया, उसके बाद पोस्ट टेस्ट किया एंड देन उसको हमने मेजर कर लिया. सो दैट इज अ प्री एंड पोस्ट डिजाइन. हमें वो डिफरेंस समझ में आया, बट वी आर नॉट एबल टू कंपेयर इट विद द एग्जिस्टिंग वन बिकॉज वी डू नॉट हैव अ कंट्रोल एंड अ कंपैरिजन ग्रुप, राइट? सो हियर इंटरवेंशन, pre-test, intervention, and post-test is pre and post-design. Then we have a static group comparison. Static group comparison means comparing a group that has received a treatment with one that has not. आपने एक ग्रुप को ट्रीटमेंट दिया, एक ग्रुप को आपने ट्रीटमेंट नहीं दिया, वो स्टैटिक था, राइट? एंड आपने उन दोनों को कंपेयर किया. So difference between the two groups are assumed to be due to the treatment. So the difference can be because of anything. Here an example is given. A hospital introduces a pain management technique. पोस्ट ऑपरेटिव पेशेंट के लिए एक पेन मैनेजमेंट टेक्निक स्टार्ट की थी. पहले जो मेडिसिन पेन मैनेजमेंट के लिए दे रही थे वो कंटिन्यू रहा, बट दूसरे ग्रुप में हमने एक और ऐड कर लिया, राइट? एंड नाउ हियर दीज 2 ग्रुप्स आर बीइंग कंपेयर्ड फॉर इफेक्टिवनेस, एंड वी आर थिंकिंग दैट दिस पेन मैनेजमेंट is moving in this direction because of this particular treatment. But again, there are so many pros and cons. So you can see there's the experimental group. Experiment group gets the treatment, whereas control group doesn't get the treatment, but we test, right? Now, when we talk about static group comparison, it seems like true experimental design भी तो ऐसा ही होगा, बट ऐसा नहीं है. क्यों नहीं है? बिकॉज द ग्रुप असाइनमेंट हमारा स्टैटिक ग्रुप में वी नो द पार्टिसिपेंट्स. द random assignment is not happening here, right? In true experimental design, we always do random assignment. Random sampling होगी true experimentation में, याद रखना इसको. और प्री एक्सपेरिमेंटल में और क्वाजी में नहीं होगी. सो स्टैटिक ग्रुप, दैट्स हाउ इट, स्टैटिक ग्रुप इज डिफरेंट देन ट्रू एक्सपेरिमेंटल, राइट? कंट्रोल ग्रुप एग्जिस्ट बट अगेन नॉन रैंडम है. प्री एग्जिस्टिंग, पहले के ऑलरेडी हमारे पास पार्टिसिपेंट्स हैं, उन्हीं पर हम टेस्ट कर रहे हैं. ओके, एंड सेम प्री टेस्ट मेजर, ओनली पोस्ट टेस्ट. नो प्री टेस्ट मेजर होगा, ओनली पोस्ट टेस्ट होगा. दोनों ग्रुप में हम पोस्ट मेजर कर रहे हैं, प्री नहीं मेजर कर रहे हैं, राइट? बट इन ट्रू एक्सपेरिमेंटल वी डू both pre-testing and post-testing. Now, what are the advantages of pre-experimental design? Cost effective hai, easy to conduct hai, we can do it in the natural environment, no randomization is required, less human intervention is required. And if we are intending to do a huge study, obviously it can be a pilot. Weak in determining the cause, but limitations kya? Obviously there is no proper pre-post, no proper compare and compare control group, no sometimes in few there is no randomization, therefore causal relationship जो होगी वो weak होगी. Exist करेगी, किस direction में जा रहा है वो बताएगी, but weak होगी. Okay, it has high threat to internal validity because of this. It challenges in assessing the integrity of result, and the results are less reliable due to the absence of control group. Am I clear up till here? सो प्री एक्सपेरिमेंटल के ये 3 डिजाइन होंगे, बट ये हम कब करते हैं? जब हम एक बड़ा एक्सपेरिमेंटल डिजाइन करना चाहते हैं और उसको हम एक पायलट पहले करना चाहते हैं. And then we want to see that what is the direction, and then we want to make the modification in our existing research design. Then we will go for it. Okay. Now, second is true experimental research design, which is also called the gold standard. When we do the experiment, we do the experiment on the basis of true experimental most of the times, because it has high internal validity and reliability. In this design, one or more independent variables are manipulated by researcher. Subjects are randomly assigned to different treatment levels, and the results of the treatment on outcome are observed. So here we have independent variables. It can be more than one. We have dependent variables, and we want to see the effect of independent over independent variable under few conditions. Conditions जिसको हम कहते हैं treatment, and randomization is there. We use random sampling technique. So here it maintains the internal validity, and it has the ability to establish causality through treatment manipulation. Now, what are the different types? Okay, so first type is pre-test and post-test control group design. This is what I have used in my research, but I have used an elaborated way in mixed method. So I will tell you later on. In pre-test and post-test control group design, participants are given pre-test. हमने 2 ग्रुप बनाए, हमने रैंडम सैम्पलिंग की. एक ग्रुप में हमने, दोनों में हमने प्री-टेस्ट पोस्ट-टेस्ट किया, बट हमने एक ही ग्रुप में क्या किया? ट्रीटमेंट दिया और उस ट्रीटमेंट की इफेक्टिवनेस को देखा. सो दिस इज प्री-टेस्ट पोस्ट-टेस्ट कंट्रोल ग्रुप डिजाइन. ओके, सो हियर यू कैन सी दैट this is an experimental group, pre-test is done, and CBT, this is a psychotherapy intervention which is given for say 30 days, and then the individuals are post-tested, participants are post-tested. In control group, we are basically moving, suppose we are conducting this test in the psychiatry hospital, so we are continuing with the medications in both the cases, pre-test kiya and directly post-test kiya, so we will be able to see the effectiveness of CBT psychotherapy, right? Then there is post-test only research design. There are certain conditions where pre-testing is not feasible, right? And there is a concern to practice effect or testing effect. Now, what is that? अगर मैं एक ही ट्रीटमेंट किसी को बार बार दूं, सपोज मुझे मेजर करना है द IQ ऑफ स्कूल गोइंग चिल्ड्रन. ओके, आई वांट टू असेस द IQ ऑफ स्कूल गोइंग चिल्ड्रन from 8 to 13 years of between 8 to 13 years of age. After and I want to see that how play way is impacting their IQ. और प्ले वे की भी चलो मैंने कोई एक टेक्निक लगा ली जिसको मैंने कहा मेरा ट्रीटमेंट है, तो मैंने उसका जब मैंने पहले IQ टेस्ट किया वो प्री टेस्ट हुआ, फिर मैंने उसको ट्रीटमेंट दिया यानी कि प्ले वे टेक्निक कोई भी लगाई और उसके बाद पोस्ट टेस्ट किया. Now a lot of books, a lot of research books do say that you have already tested the child with certain parameters, with certain questionnaire or with certain performance test before. Now the child is aware of the answers, even if it is after 1 week, 2 weeks, 3 weeks, right? The child is aware of the answers, so uski memory mein wo kuch rahega. So the test that we'll get in the post will be anyhow, वो treatment के before treatment दे या ना दे, but there will be some improvement because the child has that memory, right? And this is called testing effect. Measurement error related to how a test is given, the condition of the testing, including environmental condition, acclimatization to the test itself, right? So what I have discussed just now. So here post only test is done to just get rid of the testing effect. The testing effect isn't always bad. In practice, our initial assessment might help children identify or put into words feelings and experiences they are having when they haven't been able to do that before, right? So when there are certain situations where pre-test is not feasible and it is not basically good for our study, we do that. So we assign, these are you can see, we assign a random, we give a random assignment to all our treatment group and control group, right? Control group is tested because there is no treatment. For this particular treatment group, again an intervention is given in between, right? And then it is post-tested. आपका प्री कुछ भी नहीं हुआ, आपने सिर्फ पोस्ट टेस्ट किया. ओके, देन देयर इज थर्ड, अगेन यहाँ क्या होगा, रेंडमाइजेशन. रेंडमाइजेशन विल बी देयर इन ऑल द थ्री. देन इज सोलोमन 4 group design, and this Solomon 4 group design is a very elaborated kind of design, right? I have never used it in my study, but this seems to be very fascinating also. But for big studies wherein we need to stamp our research anyhow, right, we go for this kind of Solomon 4 group design. One way we can possibly measure how much testing effect might change the result of the experiment with the Solomon 4 group design. So obviously it is for testing effect, right? हम जो भी चीज प्रूव कर रहे हैं उसको हम डबल बार प्रूव कर रहे हैं इसमें. So there are 4 groups here. First group आपका test group होगा, second group is going to be control group, third group test group, and fourth group is control group. So the first pair of group, experimental and control group, receives both pro-test, post-test and pre-test. हम first जो आपका group होगा, let me show you here, right? This is RA is the experimental group. This is RC is the control group. So here you have seen that in RA and RC, what you have done? एक ग्रुप में पोस्ट टेस्ट एंड प्री टेस्ट होगा दोनों में, और दूसरे ग्रुप में क्या होगा, आपने एक्सपेरिमेंटेशन, दीज आर एक्सी, यू कैन से दिस इज एक्सपेरिमेंट जो आपने दिया है या इंटरवेंशन आपने दिया है, जो ट्रीटमेंट दिया है, राइट? सो इसमें क्या हो रहा है, यू आर डूइंग ओनली पोस्ट टेस्ट. सो हियर द रिजल्ट हियर एंड द रिजल्ट हियर, द सिमिलैरिटी बिटवीन द रिजल्ट्स and the relationship between the results will identify कि ये testing effect है भी या नहीं है. Are you getting my point? So basically you are avoiding and you are trying to rule out any red flag if there is. Suppose if there is a red flag of testing, you can use this research design. What are the key takeaways for true experimental research design? Obviously explanatory है, causal relationship करता है, right? True experimental requires random sampling, control and experimental group, pre-testing and post-testing, right? And the post-test only research design involves 1 point measurement, post-intervention. Solomon 4 group, obvious, it explains the testing effect nicely, right? Rules out the testing effect. So this is what is your true experimental research design. Now comes your quasi experimental research design, which we people use, most of us use in nowadays, right? When we talk about quasi experimental research design, it is an experimental research design, but it is not true experimental. अगेन क्या हुआ ट्रू एक्सपेरिमेंटल में? रैंडमाइजेशन हुआ. यहां रैंडमली असाइंड नहीं है, यहां रैंडम सैम्पलिंग नहीं है. मे बी इट इज कन्वीनियंट, मे बी इट इज जजमेंटल, राइट? मे बी यू आर बेसिकली स्टडिंग population, a very specific kind of population, right? Although the independent variable is manipulated, participants are not randomly assigned to conditions and orders of condition. Because the independent variable is manipulated before dependent variable is measured, quasi-experimental research eliminates directionality problem, but it is very much reliable, right? In terms of this internal validity, quasi-experimental are generally somewhere between. कोरिलेशन से ज्यादा इंटरनल वैलिडिटी होगी, बट ट्रू एक्सपेरिमेंटल से कम होगी. ओके, नाउ इन क्वाजी एक्सपेरिमेंटल वी हैव नॉन इक्विवेलेंट ग्रुप डिजाइन. ये these are the types of quasi experimental. Now what is this non equivalent group design? It is a between subject design in which participants have not been randomly assigned any condition. So as you can see, what are the features? Pre-existing group होगा आपका, क्लास स्टूडेंट्स, कॉलेज स्टूडेंट्स, प्री एग्जिस्टिंग ग्रुप है, और पेशेंट्स इन ICU, पेशेंट्स इन CCU, right? Group equivalence may be different initially. The number of participants may differ initially in both the groups, right? Measurement involves pre-test and post-test measures, and control group exists but may differ in the baseline characteristics. कंट्रोल ग्रुप और टेस्टिंग ग्रुप में आपके थोड़ा सा डिफरेंस हो सकता है. इट इज susceptible to selection bias, because obviously because our assignment is not random, we have not randomly assigned. Okay, so there are certain conditions wherein we have ethical constraints, we have certain other constraints, then we can go for such kind of design. Now the second kind of quasi experimental research design is pre-test post-test design, wherein the dependent variable is measured once before the treatment is implemented and once after the treatment is implemented. That means the testing is done before and after. For example, a researcher who is interested in the effectiveness of anti-drug education program on elementary school students' attitude towards illegal drugs. Suppose this is what is happening. This is what the researcher is doing. The researcher could measure the attitude of student at a particular elementary school during 1 week. एक implement कर लेगा, उसने pre-test कर लिया, implement कर लिया anti-drug program, and finally measure the attitude in the following week. So pre-test and post-test हुआ, but again the participants have not been randomly assigned. Now the pre-test post-test design is much like within subject experiment, in which participant is tested first under the control condition and then under the treatment condition, right? Moving ahead, there is interrupted time series design. Now this interrupted time series design is very much useful for head injury clients. So one of my colleague, he did a research and his research took around 7 to 8 years. He did a research on the impact of neuro-linguistic programming on the improvement of head injury clients, right? And he did a time series experiment. There were only 5 participants, but those 5 participants were tested for good 3 years. Every month, he used to test the participants on the basis of cognitive functions, improvement of cognitive functions every year with the use of an NLP. So what was the condition? NLP was the condition, right? So this is called time series. Time series is a set of measurement taken at an interval over a period of time. So here another example is given. A manufacturing company might measure its workers' productivity each week for a year, or assessing the cognitive function of head injury patient post-surgery using mindfulness as an intervention. Right? So जब हम ये medical cases करते हैं, टाइम सीरीज में बेस्ट चीज ये होती है कि आपका सैम्पलिंग, द बेस्ट पार्ट ऑफ टाइम सीरीज इज द सैम्पलिंग इज वेरी लेस. And from one sample, from one participant, you are getting huge amount of data because you are testing the participant probably every week, depending on the nature of your title or month, right? But you are collecting the data of a client in in-depth manner. Notice that the interrupted time series design is like pre-post test, but multiple times pre-test and post-testing is happening. It is unlike the pre-test post-test design, however, in that it includes multiple pre-test and post-test measurement. Now there is also a combination design in quasi-experimental design, wherein any type of other quasi-experimental design can be clubbed if it is required. तो जो कहीं नहीं आता quasi-experimental वो हम इसमें डाल देते हैं, right? Now there is something known as statistical design. So statistical design is a collection of basic experimental design that offers researchers the ability to statistically control and analyze external variables. Now into experimental research design, in your quasi-experiment, in your other quasi-experimental research designs, or in your other types of pre-experimental research design, this statistically control हमारा जरा कम होता है. So statistical control uses various sophisticated statistical techniques to exclude the influence of extraneous variables. Now, if I am conducting a study in a high altitude, my oxygen content is a problem, my temperature is a problem, my obviously the basic amenities is also a problem, electricity is also a problem, right? So a lot of extraneous variables are there, which is going to, or which have the power to impact my study. Okay, so for such kind of designs, we can go for this statistical design. Randomized block design, probably you have not heard about it because we generally don't use it, right? Latin square design and factorial design. What I have used in my study was a type of factorial design. So with what has happened, what happens in randomized block design? Randomized block means randomly aapne, just take the literal meaning. Randomly you have taken the participants, you have selected the participants. Suppose the participants are school going children. Now you have categorized or blocked the participants as 6th class, 7th class, 8th class and 9th class, right? So these are your 4 groups, blocks. So randomly you have picked up any school and 4 classes from any school. Okay, so this is what is happening. And now to every class you have given an experiment and conducted the experimental study. This is called randomized block design. So let's see what the slide says. The subject within each block are randomly assigned to treatment condition. This design reduces variability within treatment condition and produces a better estimate of the treatment effect. See, 9, 10th, 11th grade, treatment method 1, treatment method 2, treatment method 3, right? And now you can compare that to 9th grade. You have made 3 groups here, given 3 different conditions. Now you can compare these 3 conditions. Similarly, 10th grade and 11th grade. Now here, a lot of selection bias you have removed. Even the variation because of the age and the IQ is also removed here, right? So this is how the statistical design is very good. Now moving ahead with the factorial design. Factorial design is again very important. It is often used by scientists wishing to understand the effect of 2 or more independent variable upon single dependent variable. जहां हमको ANOVA और MANOVA लगाना है. Understood? 2 variable है या उससे ज्यादा variable है, and you have 1 dependent variable, and then you want to understand the impact of those variables, the relationship between the variables and how they are connected to each other. There you use the factorial design, right? So now this is an example, effect of study environment and sleep duration in academics. So study environment, sleep duration, these are the factors involved, right? Independent variable, and impact on study is dependent variable. Similarly here, diet and exercise interaction on weight loss, diet type and exercise intensity, your independent, and here it is your dependent variable, right? Now coming on to the last type of statistical design, which is Latin square design. Latin square design is the experimental design that can be used to control the random variation of two factors. Two factors means two independent variables which we'll be manipulating. दो इंडिपेंडेंट वेरिएबल का रैंडम आप क्या करोगे, उसको किस तरह से कंट्रोल करोगे और कैसे आप समझोगे. So I'll give you an example here, right? Here you can see each letter presents a fertilizer, and each row represents a sunlight exposure block, and each column represents the soil quality. Okay, now you can see the letters are fertilizer treatment, the rows are sunlight exposure, and your columns are soil quality. अगर आप किसी फर्टिलाइजर की इफेक्टिवनेस को चेक करना चाहते हो, okay, with experimentation on a particular soil, तो obviously soil type वहां का मैटर करेगा. सनलाइट एक्सपोजर आपने दो कंडीशन दे दी, योर सॉइल क्वालिटी एंड सनलाइट एक्सपोजर, और उसके ऊपर इन दोनों कंडीशंस को रख के आप इन चारों को क्या करना चाहते हो, समझना चाहते हो, right? So there you will use a factorial design. Okay, so that is also a quasi experimental design. Now coming on to mixed method. Mixed method नहीं था, मैंने इसलिए इसमें इसको जोड़ा because most of the times nowadays we are using mixed method because mixed method is considered to be the best design nowadays. As far as social sciences and humanities are concerned, I'm not so sure about science. I'm sure about medical, but medical and neuropsychology, right? So there are 4 slides. Please focus on these 4 slides. We have understood the correlational and different types of experimental research design. Now it is mixed method. Mixed method means you are mixing qualitative and quantitative research designs. Now, design can be based on either or both perspective, both qualitative and quantitative. Research problem can become a research question and hypothesis. Sample sizes vary based on the method used, and data collection can involve any technique available to the researcher, and interpretation is continual and can influence in the research process. Now, there are different types of mixed method. Mixed method simple hai, qualitative, quantitative mix is called mixed method. Now, what is mixed method? Sequential exploratory. Sequence का मतलब क्या है? Quantity पहले, explanatory मतलब explanation बाद में. Explanation किस में आएगा? Quality में, right? So that means collection and analysis of quantitative data followed by collection and analysis of qualitative data, right? So during my PhD, I have used mixed method, quasi-experimental, sequential, explanatory design. This was my research design, right? Which type of quasi-experiment, pre and post, right? So here it is characterized by collecting the quantitative data and then qualitative data later on. So here we use the qualitative result to assist in explaining the interpretation of quantitative result. So it is basically we are seconding our research with the qualitative data. Sequential exploratory. In sequential exploratory, the initial phase of qualitative data collection and analysis is followed by quantitative. So here qualitative you will do before and then quantitative you will do later. So here this is to explore the phenomena. This strategy may be useful when developing or testing a new instrument. If you are creating a tool, psychological tool or something, some new instrument, then we go ahead with sequential exploratory. Then there is sequential transformative. Sequential transformative means collection and analysis of either quantitative or qualitative. कोई भी आप first कर लो, but the results are integrated in the interpretation phase. When you are writing the result, they will be combined. One is not seconding each other, but you are taking both of them into consideration. So basically, the purpose is to serve the theoretical basis. Then concurrent triangulation. Concurrent triangulation is 2 or more methods used to confirm, cross-validate, and corroborate findings within a study. Data collection is concurrent. Here we are concurrently collecting qualitative and quantitative data to cross-validate our result. So side by side quantitative और qualitative चलता रहेगा, But what are we doing? We are kind of cross-validating our own qualitative and quantitative data. Why we are doing it? Because if I have a thought that yes, there can be certain weaknesses, so I want to overcome the weaknesses and understand the strength. So for that, we use this. Then there is concurrent nested. Concurrent nested means a nested approach that gives priority to one of the method and guides the project while another is embedded or nested. That means the purpose of nested method is to address different questions than the dominant or to seek information from different level. राइट सो जो भी आप क्वालिटेटिव और क्वांटिटेटिव कर रहे हो उसके अंदर आपका क्या चल रहा है, इन बिटवीन द लाइंस जो आप रीड कर रहे हो, टू टेस्ट दैट you use this approach. Then there is concurrent transformative. To evaluate the theoretical perspective at different levels, we use this research. And these are the strength of experimental research designs. Obviously, reliability is high, validity is high, randomization is used, therefore, high level of control is there. Sometimes in time series, the subject, the number of participants is also less, and the result of experimental study can be duplicated. Remember that, right? Suppose I have conducted an experiment on 500, I can always conduct it on a 2000 ka sample and go ahead, right? It will increase the horizon of my research, and it can be combined with any other research method, as in a mixed method I have just shared, and natural setting can be replicated with the faster speed, and experimental research allows cause and effect to be determined. Majorly, experimental research designs jitne bhi hote hain hamare, we use it to benefit the society. So by our validation and by increasing our reliability. Okay. Now, any doubt, anybody? I wanted to make it as clear as I could be, but there are so many research designs, and we can have at least two classes on one type of research design. So it has so much, but the basics probably you have understood. Right, everyone? So choose your research design mindfully. If you are thinking about experimental, randomization. True experimental, simple याद रखो randomization. Validity चाहते हो ज़्यादा होनी चाहिए, random study. Right? Random study नहीं कर सकते, but आप you are interested in exploring quasi-experimental, mixed method. The best is mixed method nowadays, as I have told you. You have no provision of doing any pre-test, do a post-test study, again experimental, right? There is no provision of any human subject. So what you can do is an experimental, the correlational study using survey, observation, case study, right? So that's all from my side. Over to you, Sneha. Thank you everyone for patient listening. I know it was an information overload, but you can always watch it on YouTube.
Thank you
Thank
so
you,
much, ma'am.
Nitesh.
Ma'am, before vote of thanks, I would like to invite Dr. Brijmohan Sharma to address the gathering. So over to you, sir.
Thank you, Sneha.
Namaskar,
Thank you,
Dr. Bridge.
नमस्कार डॉक्टर दीपिका. रीता जी भी हैं क्या?
Rita ma'am is not there. मेरे ख्याल से Rita ma'am नहीं है.
नहीं है.
वो अभी ऐसी जगह है जहां नेटवर्क नहीं है, डॉक्टर ब्रिज.
कोई प्रॉब्लम. तो लेट मी स्टार्ट.
हाँ जी.
नमस्कार एवरीबॉडी. आप लोगों ने बड़े धैर्य से ये 12-13 दिन जो है सुने, गुजारे, और डिफरेंट एक्सपर्ट्स आए. मैं इसको फॉलो भी कर रहा था, और जो क्वालिटी है मेरे हिसाब से तो हमारा प्रोग्राम है तो हम अच्छा ही बोलेंगे, लेकिन मेरे ख्याल से जो फीडबैक्स आ रहे हैं, जो औरों से बात हो रही है, जो है कई पार्टिसिपेंट से भी मेरी बात हुई, तो जितने भी लेक्चर्स हुए हैं वो अप टू मार्क हैं। और ये एक अच्छा फैकल्टी डेवलपमेंट प्रोग्राम था, और इसकी चर्चा बहुत हुई है। मैं आपको बताऊं, कई यूनिवर्सिटीज में इसकी चर्चा है कि इस तरह का प्रोग्राम जो है ऑनलाइन हुआ और सक्सेसफुल हुआ, और जो क्वालिटी ऑफ रिसोर्स पर्सन है वो बहुत अच्छे थे, वो रिमार्केबल थे, और सब अपने अपने फील्ड में जान पहचाने थे। तो ये एक अच्छा प्रयास रहा, और मुझे लगता है कि ये एक सीरीज हमें स्टार्ट करनी चाहिए और भी यूनिवर्सिटी लोगों के साथ, और एक गैप के साथ हम क्वार्टरली कर लें या हाफ ईयरली कर लें इसको। तो मुझे लगता है कि ये फैकल्टी को बहुत ज़्यादा इम्प्रूव करेगा। और मेरी बल्कि डॉक्टर जोशी से भी बात हो रही थी, जो वाइस चांसलर श्रीदेव सुमन हैं, तो वो भी ये कह रहे थे कि डॉक्टर ब्रिज, ये बहुत अच्छा प्रोग्राम डॉक्टर दीपिका और डॉक्टर रीता जी ने और आप लोगों ने शुरू किया है, हमें भी शामिल किया, ये और अच्छी बात है। और मैं कोशिश करूंगा आगे से जो है हमारे जितने भी कॉलेजेस हैं उनमें सर्कुलेट किया जाए, थोड़ा एडवांस में हो जाएगी बात तो डेफिनेटली। और ये क्वालिटी ऑफ एजुकेशन को और नई एजुकेशन पॉलिसी को भी इम्प्रूव करेगा ये फैकल्टी डेवलपमेंट प्रोग्राम। तो ये मेरी तरफ से आप सबको बहुत बहुत बधाइयाँ। और प्लीज आप खुलकर सच्चे मन से आलोचनात्मक फीडबैक दीजिएगा लास्ट में, जिससे कि हमें पता चल सके कि क्या कहाँ 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 गड़बड़े हुई हैं। तो प्लीज आप, कई चीजें होती हैं, तो ये अब वो टाइम तो रहा नहीं जब हम लोग पढ़ते थे तो गुरुजी के सामने बोल ही नहीं सकते। तो यहाँ एटलीस्ट आपके पास एक ऐसा प्लेटफॉर्म है, आप कभी भी डिस्कस कर सकते हैं, कभी भी बात कर सकते हैं। तो मुझे लगता है मेरी तरफ से बहुत बहुत बधाई है। और डॉक्टर दीपिका को इस बात के लिए, इस चैलेंज को लेने के लिए, उनके साथियों को, स्नेहा और बाकी सब साथियों को मैं बहुत, क्योंकि एक बड़ा बीड़ा उन्होंने उठाया था, ये बड़ा काम था और बहुत सक्सेसफुली एंड अप हुआ। तो आप सबको बधाई, साधुवाद, और मेरी तरफ से एनी टाइम पार्टी देहरादून में। थैंक यू सो मच दीपिका, थैंक यू स्नेहा।
बहुत बहुत धन्यवाद डॉक्टर ब्रिज। ये प्रोग्राम जो है, ये तीनों हमारी ऑर्गेनाइजेशंस के कोलैबोरेटिव एफर्ट से इतना सक्सेसफुल हुआ, चाहे वो एक्सपर्ट्स को इनवाइट करने की बात हो और चाहे हमारे टॉपिक्स को डिसाइड करने की बात हो। तो जो हमारा ये माइंड बॉगलिंग सेशन हुआ कि ये टॉपिक्स जरूरी हैं और ये टॉपिक्स इंक्लूड करने चाहिए हमारी ऑर्गेनाइजिंग कमेटी के श्रीदेव सुमन से, स्पेक से और स्पीकिंग क्यूब से, वो मुझे लगता है बहुत ही फ्रूटफुल रहे। कुछ तो सेशन मैंने ही किए, अब मुझे मालूम नहीं है कितना पसंद आया सबको, बट आई थिंक ऑल द एक्सपर्ट्स हैव गिवन देयर बेस्ट। सो थैंक यू सो मच डॉक्टर ब्रिज। डॉक्टर ढींगरा है यहाँ पर।
हाँ जी,
ओवर टू यू स्नेहा।
Thank you so much, sir. Now I would like to invite Professor Dr. Gulshan Kumar Dhingra, sir, to address the gathering. Over to you, sir.
ढींगरा सर हैज, ढींगरा सर आपका म्यूट पर है।
I think there is some network issue.
नहीं
उनके
म्यूट
यहाँ
है। ढींगरा सर आप वीडियो ऑफ कर लीजिए, वीडियो ऑफ करके आप अनम्यूट कर पाएंगे।
सुन पा रहे हैं मैडम मुझे?
हाँ जी सर।
वो शायद कुछ नेटवर्क का इशू है। अभी आ रही है ना?
हाँ जी सर।
नमस्कार, वेरी गुड इवनिंग ऑल ऑफ यू। तो आज ये जो हमारा ज्वाइंट वेंचर था, स्नेहा ने इसमें बहुत अच्छा रोल नहीं किया डे 1 से। तो इसमें स्पीकिंग क्यूब, स्पेक्स, श्रीदेव सुमन, उत्तराखंड यूनिवर्सिटी, तीनों ने मिलके इसको ऑर्गेनाइज किया। और ये जो एफडीपी थी, जैसा कि दीपिका मैम ने भी बोला कि इनके लिए भी एक पहला उस तरह का इतना बड़ा एक साथ प्रोग्राम था। और ब्रिज भाई तो खैर इनका तो बात ही अलग है, इनके पास तो असीम वो है, अपार संभावनाएं रहती हैं हमेशा चीजों की। लेकिन जो श्रीदेव सुमन उत्तराखंड यूनिवर्सिटी को आपने जोड़ा और हमें अच्छा प्लेटफॉर्म मिला अपनी यूनिवर्सिटी को करने का, तो हम इसके लिए दीपिका मैम का, शर्मा जी का और पूरी जो टीम है हम सब लोगों की, इसका तहे दिल से मैं शुक्रिया अदा करता हूँ। और इसमें सबसे महत्वपूर्ण जो है हमारे पार्टिसिपेंट्स जो इंडिया के डिफरेंट कॉर्नर से जुड़े थे, और उसमें मेजॉरिटी जो थी हमारे रिसर्च स्कॉलर्स की थी, और हर एक ने बड़े कायदे से, मुझे लग रहा है कुछ तो ऐसे हैं जिन्होंने 100% अटेंडेंस दी है अपनी, और अभी भी 13 दिन लगातार, जो कि किसी के लिए भी आसान नहीं होता, और उसी सेम टाइम में स्नैच कर पाना। और लेकिन आपकी जो कंसिस्टेंसी रही उसके लिए आपको ढेरों धन्यवाद, शुभकामनाएं। और ये जो आपकी टीम है दीपिका, रियली और कमेंडेबल, और आपकी जो 13 दिन तक लगातार उसी पोज में रहना, और इतना, और फिर रिसोर्स पर्सन भी, मैनेजर भी, और सब कुछ ऑल इन वन, उसके लिए रियली हैट्स ऑफ टू यू। और हम आगे भी जुड़े रहेंगे, और मुझे पूरा विश्वास है, जैसा कि भाई ने बोला, कि जो खामियां हमसे रह गई हों, और या और लगता है आप हमारे सब, अब हमारे जो कोलैबोरेटर्स हो गए हैं जितने हमारे वो थे पार्टिसिपेंट्स, तो मुझे लगता है अब हम उसे जैसे डिजाइन करके आप उसी कंसिस्टेंसी से, तो मैं चाहूंगा एक ग्रुप हम ये मेंटेन करें इन सब पार्टिसिपेंट्स का, क्योंकि मुझे लग रहा है श्रीदेव सुमन से भी हमारे बहुत सारे बच्चे जुड़े। और हमारे जो कॉलेज, एक कॉलेज जिसने हमें सबसे ज्यादा सपोर्ट किया वो विवेकानंद कॉलेज रुड़की, जिसे मैं देख रहा था कि उन्होंने 15 का स्टाफ था, तो 12 या 13 लोग उनके प्रिंसिपल, ये भी लगातार जुड़े रहे हैं। उड़ीसा से डॉक्टर अशोक कुमार जी, और इनके जो काफी सारे लोगों को इन्होंने जोड़ा हमारे साथ। और हालांकि बहुत सारे ऐसे लोग हैं जिनका मुझे अभी नहीं ध्यान आ रहा है, लेकिन आज जो ये 50 और 70 लोग तक हमारे साथ गए हैं, तो इसका मतलब आप सबने बहुत ही शानदार रिस्पॉन्ड किया है ना, हर उस व्यक्ति को जो हमारे साथ इस 12-13 दिन रहा। खासकर मैं भी ये नहीं कह पाऊंगा क्योंकि मैं खुद भी नहीं रह पाया, क्योंकि इस बीच में कई सारे ऐसे असाइनमेंट्स है जिसके लिए मैं लगातार बिजी था सुबह से शाम तक, और 7 से 9 वाले टाइम में भी जुड़ने का अवसर नहीं मिल रहा था। तो आज मुझे था मुझे कैसे भी जुड़ना है। तो रियली सभी का तहे दिल से धन्यवाद, और मुझे पूर्ण विश्वास है कि हम फिर एक नए प्रोग्राम के साथ, दीपिका मैम के साथ और ब्रिज भाई के सौजन्य से, हम कुछ आगे भी ऐसे ही अच्छा करेंगे। इसी प्रत्याशा में आप सभी को शुभ रात्रि, धन्यवाद, गुड नाइट।
Thank you so much, Dr. Dhingra, for being there, for always being there and supporting the positive endeavor of SpeakingCube. ये हमारा जो collaborative effort था, जो हमने टेबल के ऊपर सोचा और डिस्कस किया कि नहीं ये नीड है और इस नीड पर बात करनी चाहिए, क्यों बाद में जाके हमारे प्रोफेसर्स और रिसर्च स्कॉलर्स को ये हम सिखा सकते हैं, क्योंकि हमारे पास इतने सारे एक्सपर्ट्स डिफरेंट फील्ड से जुड़े हुए हैं, नेशनल और इंटरनेशनल। नेशनल लेवल पे हमारे डॉक्टर राजेश, डॉक्टर अनीता, डॉक्टर निधि, डॉक्टर रीटा और भी बहुत सारे एक्सपर्ट्स थे। इंटरनेशनल लेवल पर हमारा मेटावर्स की डेटा साइंटिस्ट डॉक्टर प्रोफेसर शिखा चमोली एंड न्यू हैम्पशायर की, तो उन्होंने इतना अच्छा सेशन दिया है। बाकी डॉक्टर धेनवाल, डॉक्टर अमीन, डॉक्टर नदीम और भी जो हमारे एक्सपर्ट्स थे, वंडरफुल एक्सपर्ट्स थे, एंड आई होप दैट एवरीबडी हैज एंजॉयड। 2 सेशन का तो बहुत ही अच्छा, हमारा सभी का अच्छा रिव्यू था, बट 2 सेशन जो मुझे पर्सनली भी बहुत अच्छे लगे वो डॉक्टर निशा और डॉक्टर काजल का सेशन था, जो मेरे लिए भी एक आई ओपनर था, क्योंकि मुझे भी वो सॉफ्टवेयर नहीं आते थे और उनके सेशन से मुझे वो सॉफ्टवेयर सीखने को मिल गए। So thank you Dhingra sir, thank you Dr. Brish, thank you Rita ma'am, and thank you Kajal and Sneha. Kajal and Sneha have been the backbone of this particular program, and thank you all the participants. Your intent matters a lot. अगर ये इतनी अच्छी इंटेंट नहीं होती तो हमारे पास 55 का नंबर रोज नहीं आता, 55 लोगों की अटेंडेंस हमारे पास रोज नहीं आती अगर ये इंटेंट अच्छी नहीं होती। सो थैंक यू एवरीवन फॉर बीइंग देयर, Now, Sneha, I request you to please extend the vote of thanks.
Thank you,
और इससे
Deepika.
पहले मुझे कहना है, मैंने 2 बहुत इंपॉर्टेंट नाम छोड़ दिए, सॉरी. वीसी सर, जोशी सर, फर्स्ट डे आने के लिए, एंड राणा सर 5th डे आने के लिए, और कार के अंदर बैठकर भी उन्होंने जो सेशन लिया, they have literally motivated this particular FDP participants. So thanks to both the universities, thanks to all the members in the organizing committee for supporting this positive endeavor, and then together we can make a difference. So over to you, Sneha.
Thank you so much, ma'am. So as we come to the close of this, I must say, enriching 12 days journey, it is truly my privilege to present the vote of thanks on behalf of SpeakingCube, our collaborator, Sridev Suman Uttarakhand University, and Specs Dehradun, and the entire organizing committee. First, our heartfelt gratitude to Chief Patron, Professor Dr. N.K. Joshi sir, Honorable Vice Chancellor Sridev Suman Uttarakhand University, for inaugurating the FDP with such an inspiring message and motivating us to think innovatively. A warm thanks also to our patron, Professor Dr. M.S. Rawat sir, for supporting this FDP. We are also grateful to our chief guest, Professor Rana Pratap Singh sir, for his valuable words and encouragement. To our wonderful speakers, Professor Dr. Rita Kumar, Professor Dr. Harpreet Bhatia, Professor Dr. Muhammad Amin Wani, Professor Dr. Rajesh Singh, Professor Shikha Chamoli Sinha, Professor Dr. Sunita Deenwal, Professor Dr. Nisha Kaushik, Professor Dr. Nadeem Lukman, Professor Dr. Nidhi Verma, and Professor Dr. Kajal. Thank you for sharing your knowledge and making each session insightful and memorable. A special mention goes to the organizing team, Professor Dr. Deepika Chamoli Shahi, Professor Dr. Rita Kumar, Dr. Chetan Sharda, Professor Dr. Gulshan Kumar Digra sir, Professor Dr. Nidhi Verma, Dr. Brij Mohan Sharma, Professor Dr. Rajesh Singh, Major Anupa Kerry, and Ms. Kajal Tomar. Your dedication and hard work shaped this FDP beautifully. And of course, to all our participants, your curiosity, questions, and reflections kept this program alive and meaningful. As we conclude, let's take forward the spirit of collaboration, innovation, and curiosity that define these 12 days and use this knowledge to transform our teaching and research. Thank you once again to everyone who made this journey possible. Thank you, everyone.
I request everyone to please switch on the camera so that we can take the photo. अभी तक तो किसी को नहीं बोला था switch on करो. I think एक photo तो बनता है.
Yes.
Let me just switch off the recording.
Ma'am, there is a participant who has raised hand.
Okay. Please